We've reached several critical points, we thought, in COVID-19, and we keep reaching more critical points. Chief Jones, thank you for being here.
Thank you, Madam Mayor, members of council, city staff, residents. I wish I had better news to present tonight, but maybe when we get through my report, I'll give you the numbers and what's going on in the community and in the state. And then we're going to talk a little bit about vaccines and maybe a light at the end of the tunnel. Let's hope so anyway. But I wish I had some better news. In the Rappahannock Area Health District, Planning District 16, which we're a part of, the total number of new cases, and I'll use this as a comparison to the last time I came before you in the beginning of December. The number of cases or new cases has risen to 1,377. We were at 796 back then. So we've just about doubled the number of new cases. The average per day has gone up from 88 to 197. The COVID patients in the hospital are now registered at 110. To kind of give you some context on this, on October 5th, 2020, we had 18 people with COVID-19 in the hospital and in the various hospitals in the health district. On November 5th, we had 25. As of today, we're at 110. So it has gone up dramatically. The total number of deaths in the health district since the beginning is 133. We've had at least 9 deaths over the last 2 weeks period. 2 of those in the city since the end of the year. None yesterday, thank goodness. Our percent positivity, the rolling 7-day average, when I came to you in December, it was right at 11.9% in the health district. We're now at 18.4%, and we were actually above 19% yesterday. The number of people we're testing runs anywhere between about 700 to 750 up to about a little bit over 900 per day, unless it's on a weekend. So our percent positivity is way up. Statewide, last time I talked with you, we had just under 2,000 people with COVID-19 in hospitals statewide. As of today, we're over 3,100 and almost 3,200 people with COVID-19 in the hospital. Persons in ICU have gone up to 582 from 435. Persons on the vent are at 349, up from 196. ICU occupancy has increased 5% from 76 to 81%. And the deaths statewide have gone up by 1,200 since the last time I talked with you on December 8th. The percent positivity 7-day average statewide is 16.4%. So here in our health district, we're 2 full percentage points above that. As you can tell, cases are surging in Virginia still. I told you that back in December, and that's still the case. 24 of the 35 health districts are in a growth trajectory, either in slow growth or in surging. We're one of the health districts that is still surging. Hospital bed availability is okay at this point, but ICUs are filling up quickly. We had 3 new hospitalizations for city residents within the last week. Again, we had the 2 deaths we had no deaths yesterday, but 2 deaths since the 30th of December. And we have had 85 new cases from city residents in the last week. So the numbers are very sobering as far as that goes. The virus is very prevalent in our community. It's very prevalent among our people. And we're just trying to do the best we can to mitigate those circumstances. Again, can't emphasize enough, hand washing, keeping your distance, wearing a mask, both outside and inside if you can't socially distance. And really the key here now is trying to stay around your family unit and avoiding any other type of crowds or things like that. If you can do things virtually, by all means. I know that's a very tough thing to do, especially as we go through this. We're now moving into the 11th month of this particular event that's going on. And unfortunately, it's a marathon, it's not a sprint. And we're gonna have to stay vigilant for a good long while. But let's talk a little bit about vaccines, and they have become on the market now and are available in our area as well. So the 2 vaccines have been rolled out. They have been given an emergency use authorization by the FDA. They're not technically approved through the entire process, but they are good enough to have an emergency use authorization. Both of these vaccines are being used in our area. One of them is manufactured by Pfizer. The other one is manufactured by a company called Moderna, and they're both being used. The state and the governor have developed a rollout plan. It's a phased approach. It develops groups A through C, and then after that, the group of the general population. So I'll kind of go through those and explain what one is each group as it goes through. The first group is known as Tier 1A. That is targeting healthcare workers and those workers and residents of long-term care facilities. This also includes public safety workers such as EMTs, medics, and some others. Our city law enforcement personnel have been upgraded to that category because they also respond on life-threatening emergency calls, medical calls, and heart attacks and overdoses and things like that. So some of our public safety personnel started receiving their first dose of the vaccine last week. That continues this week and then into next week. So we have several of those clinics set up to be able to do that. Both of the vaccines that I mentioned, the Pfizer and the Moderna, require 2 doses. One is 21 days after the first one to get your second dose. The other one is 28 days after the first one. But you're given a vaccination card when you get your vaccine delivered to you, and it'll tell you when you can get your second dose. The second group is known as Tier 1B. They're starting to take reservations for that now, or registrations for that now. And that includes some other first responders. It includes childcare and K through 12 teachers. It includes frontline essential workers, both in the public and the private sector, especially in manufacturing, food and grocery stores, transit workers, and postal workers. Very important here. Also in this group are those age 75 and up. This group is now being scheduled. I want to stress that those age 75 and up can make a reservation now to get the vaccine. They're certainly very vulnerable to that situation and oftentimes have underlying conditions, so it's important that they schedule to get their vaccine. As of earlier today, 5,000 seniors in our health district had registered for their vaccine slots. So that's a good news. We're starting to see that, and that's positive, but we want to emphasize that. We've also put information up on our Facebook page and the city's website that you have a link that you can go to that connects that allows you to start doing your registration. So if anybody's concerned about that, please go to our Facebook page or our website and click that link, and that will allow you to do that. Also, Mr. Bill Freeling, who's our Director of Economic Development, has put out a blog targeting letting our businesses know about the vaccine availability and that the various groups can start getting their staffs ready to register. So we're trying to let our business community know about that. We've also reached out to all the grocery stores located in the city to let them know their employees will qualify under this Tier 1B, and it's time to get those people registered. City departments are now working to develop their lists of employees so that they can get registered with the Virginia Department of Health by this coming Friday. The third group is Tier 1C. That involves essential workers in the construction, transportation, food service, and utility industries, as well as anyone age 65 and older, and folks between 16 and 64 who have high-risk medical conditions. And those people will be in Group 1C, which will be right after 1B. We're starting to move a little bit quicker with the vaccinations. That's a good thing. We originally thought that the public safety workers and the healthcare workers would be in early January. That's kind of moved to the middle of the month. And then we thought that the Tier 1B, which we talked about the age 75 and the other ones that qualify for that, the other essential workers, would probably be late February, early March. That's now moved up. Probably you'll start seeing those vaccinations maybe as early as the 25th of January. And then 1C could easily move into February rather than being farther pushed out. So I think that's a good sign as far as trying to get those done. And finally, the last group is those of the general population. But as we start moving and more vaccines become available and we get vaccination plans in place where we can deliver vaccines in a fairly timely manner to those people that want them, then I think you may be able to see that move up as well. We're originally talking about, end of May, June, something like that. My hope is that depending on those number of people that want the vaccine and the availability of it, if we get the program working statewide, that maybe we can move that up a little bit. But time will tell on that. We don't know yet. It's just a little bit too early to be able to handicap that. So what are we doing in Fredericksburg to try to get the word out and to let people know about this? A couple of things we've worked with our regional partners on. One is the city has volunteered to assist the Virginia Department of Health with staffing a phone bank to guide residents to vaccine registration. This is being formulated now, and will probably be involved people working in phone banks in the EOC, whether it be in the city or another locality, to take those questions and answers and get that information out to people. The other thing is the city has published new information from VDH today, as I mentioned, on our website and our Facebook page, and has emailed infos to the city businesses encouraging them to register their employees now. And the last thing that we're looking at is the city is in discussions with the Virginia Department of Health on the potential to use full-time EMS professionals to support the vaccination efforts in hope of speeding up the distribution. So we are working collectively as a city staff together to try to not only protect our people, but to try to do the right thing for the citizens of Fredericksburg and to try to get these vaccinations moving forward in conjunction with the Virginia Department of Health and our